Hi, I'm Garvin. Welcome to another telehealth video series. In this video, I will give a brief overview of what you need to know about hypothyroidism. In particular, I will cover what is hypothyroidism, how you treat it, and how you can live with hypothyroidism. So we start with what it is. Hypothyroidism, or underactive thyroid, is too little thyroid hormone. It's a condition in which the body lacks sufficient thyroid hormone. Since the main purpose of thyroid hormone is to run the body's metabolism, it is understandable that people with this condition will have symptoms associated with a slow metabolism. There are two fairly common causes of hypothyroidism. The first is a result of previous inflammation of the thyroid gland, which leaves a large percentage of the cells in the thyroid damaged and incapable of producing sufficient hormone. The most common cause of thyroid gland failure is called autoimmune thyroiditis, a form of thyroid inflammation caused by the patient's own immune system. The second major cause is the broad category of medical treatments. The treatment of many thyroid conditions warrants surgical removal of a portion or all of the thyroid gland if the total mass of the thyroid producing cells left within the body are not enough to meet the needs of the body. The patient will develop hypothyroidism. Symptoms of hypothyroidism. So you have fatigue, weakness, weight gain or increased difficulty losing weight, coarse dry hair, dry, rough, pale skin, hair loss, cold intolerance, muscle cramps, and frequent aches. Also constipation, depression, irritability, memory loss, abnormal menstrual cycles, decreased libido. Now, each individual patient may have any number of these symptoms, and they will vary with the severity of the thyroid hormone deficiency and the length of time the body has been deprived of the proper amount of hormone. So you may have one or of these symptoms as your main complaint, while another will run or will not have that problem at all and will be suffering from an entirely different symptom. Most people will have a combination of these symptoms. Occasionally, some patients with hypothyroidism have no symptoms at all, or they are just so subtle that they go unnoticed. If you have these symptoms, you need to discuss them with your doctor. Additionally, you may need to go to an endocrinologist. If you have already been diagnosed and treated for hypothyroidism and continue to have any or all of these symptoms, you need to discuss these continued symptoms with your GP. So potential dangers of hypothyroidism. So because the body is expecting a certain amount of thyroid hormone, the pituitary will make additional thyroid stimulating hormone in an attempt to entice the thyroid to produce more hormone. This constant bombardment with high levels of TSH, or thyroid stimulating hormone, may cause the thyroid gland to become enlarged and form a goiter. So, and left untreated, the symptoms of hypothyroidism will usually progress, and rarely complications can result in severe, life-threatening depression, heart failure, or coma. Hypothyroidism can often be diagnosed with a simple blood test. In some people, it's not so simple, and more detailed tests are needed. So next is, how do you treat it? The treatment that you receive will depend on the size of the goiter and any associated symptoms, and whether you have any underlying thyroid conditions. So the first is hormone therapy. If testing reveals that you have an underactive thyroid, one treatment option is to use a synthetic hormone called thyroxine or L-troxin to replicate your normal thyroid function. The synthetic hormone is taken orally, usually once a day, and in most cases, hormone therapy will need to be maintained for life. So thyroxine can also be used, which has a very similar action, or levothyroxine can be used again, which is similar to L-troxin but works quicker. It is often used when a more rapid response is required. Now next is iodine supplements. If your goiter is caused by an iodine deficiency, your GP may recommend iodine supplements. Iodine supplements also have available in pharmacies without a prescription, but you should always speak to your GP before taking them. This is because the amount of iodine needed by the body varies from person to person. Taking too much iodine could cause other health problems and can also have a toxic effect. And finally, how do you live with hypothyroidism? Generally, there's no hypothyroidism diet. Although claims about hypothyroidism diets abound, there's no evidence that eating or avoiding certain foods will improve thyroid function. If you have hypothyroidism, take thyroid hormone replacements as directed by your doctor, generally on an empty stomach. It's also important to note that too much dietary fibre can impair the absorption of synthetic thyroid hormone. Certain foods, supplements and medications can have the same effect, including walnuts, soybean flour, iron supplements, multivitamins containing iron, calcium supplements, antacids, and some ulcer medications such as sucralfate, some cholesterol-lowering drugs such as cholestyramine. So to avoid potential interaction, avoid these products or use them several hours before or after you take your thyroid medicine. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing hypothyroidism more effectively on a day-to-day basis. To start with, we have numerous products to get you up and running on an exercise program, such as exercise balls, floor mats, weights, and various other items you need to get a program up and running. And the program will be created together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as selenium, iodine supplements, fish oils, and evening primrose oil. We also have light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30 minutes clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing hypothyroidism with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.